Well, we've all been very excited about today, about coming here. We hope to be partly to inform you about what we're doing, but also to give back to the community here. I've been here since January, and we started the first robotic heart surgery in Tucson in January 28th. And since then we've done 100 cases, and half of those, so 50 cases, have come from this community. This is a new technique that we're doing. Robotics and heart surgery haven't been commonly done together across the country. I'll show you some of the data on how our program volumes compare to some of our surrounding competitors. But it requires a certain amount of trust, which we understand and deeply appreciate. We hope that we've used that trust fairly and delivered on our promises. I'm going to show you some results today of our program. I'd also like to have my colleagues here that are part of the program, Dr. Molly Serlip, talk about what she does that adds additional value to the robotics, because we can't use robotics on everybody, but if we team up with a cardiologist, we can use it on a lot more patients than we might have been able to do otherwise. And then the final person that's going to talk today is Dr. Alan Raskowski, who is an expert at robotic mitral valves. You know, it turns out that if you do a lot of one thing, you get really good at it. And so that's why we recruited Alan, is because he is an expert at the mitral. So in general, though, I want this to be giving back to you guys, let you know what we're doing, and this should be more of a discussion than a lecture. So if there's any comments that you want to make at any point, we'd like you to interrupt. You know, comments, critiques, criticisms, insults. Just come on out and tell us what you're feeling, because this is for you. This isn't for us to try to give you a sales pitch or anything like that. Okay, so with that said, let's go ahead and talk about what's been going on at the University of Arizona in cardiac surgery. Dr. Sherlock is a former major in the Army. And is our new director of this hybrid program, which he's going to talk to you about. It's where the cardiologists and the cardiac surgeons